Welcome to a presentation about laryngectomy and tracheo-esophageal puncture brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. An analogy for laryngectomy and tracheo-esophageal puncture is like a garden hose. The larynx is like the hose, and the tracheo-esophageal puncture is like a hole in the hose. The hole allows air to pass through, but it also allows food and liquids to pass through as well. In a laryngectomy, the larynx is removed, so there is no longer a hose for air to pass through. The tracheo-esophageal puncture creates an artificial opening between the throat and the stomach, allowing air to pass through while also allowing food and liquids to pass through as well. A laryngectomy is a surgical procedure that removes all or part of the larynx, which is the voice box. Tracheo-esophageal puncture, TEP, is a procedure that creates an opening between the trachea and esophagus to allow air to pass from the trachea into the esophagus. Common symptoms of laryngectomy and tracheo-esophageal puncture include difficulty speaking, hoarseness, coughing, and shortness of breath. Other symptoms may include difficulty swallowing, chest pain, and a feeling of something stuck in your throat. In some cases, patients may also experience excessive saliva production or a whistling sound when breathing. A laryngectomy is a surgical procedure that removes all or part of the larynx, which is the voice box. It is most commonly performed to treat cancer of the larynx, but can also be used to treat other conditions such as vocal cord paralysis or severe trauma. The demographics of this condition vary depending on the underlying cause. In general, laryngectomies are more common in men than women and are most often performed in people over the age of 60. People who smoke or have a history of smoking are at an increased risk for developing laryngeal cancer and therefore may be more likely to require a laryngectomy. Additionally, people with certain genetic conditions, such as Fanconi anemia, may be at an increased risk for developing laryngeal cancer and may require a laryngectomy. Tracheoesophageal puncture, TEP, is a procedure that creates an opening between the trachea, windpipe, and esophagus, food pipe. This procedure is typically performed in patients who have had their voice box removed due to cancer or other conditions. The demographics of this condition vary depending on the underlying cause, but it is most commonly performed in people over the age of 60 who have had their voice box removed due to cancer or other conditions. A laryngectomy is a surgical procedure that removes all or part of the larynx, which is the voice box. Tracheoesophageal puncture, TEP, is a procedure that creates an opening between the trachea and esophagus to allow air to pass from the trachea into the esophagus. The cause of these conditions can vary depending on the individual. In some cases, it may be due to cancer of the larynx or throat or due to trauma or infection. Other causes may include congenital defects, such as a cleft palate or vocal cord paralysis. In some cases, a laryngectomy may be recommended as a preventative measure for people at high risk of developing throat cancer. Treatment for laryngectomy and tracheoesophageal puncture typically involves surgery. During the procedure, the surgeon will remove the larynx and create a new opening in the neck to allow air to enter the lungs. The surgeon may also create a new opening between the trachea and esophagus, allowing food and liquids to pass through. After surgery, you may need to use a speaking valve or other device to help you speak. You may also need speech therapy to help you learn how to use your new voice. In some cases, radiation therapy may be used after surgery to reduce the risk of recurrence. The prognosis of laryngectomy and tracheoesophageal puncture is generally good. Most patients who undergo this procedure experience improved quality of life and are able to return to their normal activities. The risk of complications is low, but there is a chance that the patient may experience some difficulty with speaking or swallowing. In some cases, the patient may need to use a voice prosthesis or other device to help them communicate. With proper follow-up care and monitoring, most patients can expect a positive outcome from this procedure. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.